In this video, we'll have a detailed overview of liver profile. So let's start with the introduction of a liver. Liver is a large organ in the upright of an abdomen and looks like a wedge in a dark reddish brown color. It weighs around about 3 pounds and possesses many vital roles in the human body. These include detoxification of toxic chemicals, storage of nutrients, formation of bile, and metabolism of drugs and many others. LFT profile is usually done to determine the functioning of a liver by the estimation of liver enzymes and proteins, including ALP, ALT, AST, albumin, and bilirubin, etc. These protein and enzymes are found in blood in normal levels usually, but exceeded when there is any abnormality in the liver or hepatocytes. Let's proceed towards parameters of liver profile. First of all, we have ALP, which is a liver enzyme, stands for alkaline phosphatase, and helps to lyse the proteins in the liver. Normal levels are 44 to 147 international units per liter. It works on the principle that it catalyzes the breakdown of 4-nitrophenyl phosphate, forming free 4-nitrophenyl and inorganic phosphates, whose concentration is proportional to the activity of ALP in the serum. The reaction is monitored at the wavelength of 405 nanometer. Then ALT, which is an acronym for alanine transaminase, and helps liver to conversion of food into energy. Reference range is 4 to 36 international units per liter. Its principle is that it causes the reverse transamination of alanine and ketoglutarate to form glutamate and pyruvate. The pyruvate is further reduced to give lactate in the presence of LDH, with oxidation of NADH into NAD, and rate of decrease in NADH is measured at 340 nanometer, which is proportional to the amount of ALT in the sample. And then there is a third liver enzyme, AST, which is an abbreviation of aspartate aminotransferase. It occurs in between 8 to 33 international units per liter normally and helps in the metabolism of proteins. Its principle follows the following reaction. L-aspartate plus alpha-ketoglutarate will give us L-glutamate plus oxaloacetate. The absorbance of this reaction is measured at 505 nanometer, which is proportional to the concentration of AST in the specimen. And then there is liver protein albumin, which is a globular protein formed by liver and carries essential nutrients including vitamins, hormones, etc. Its normal range is 3.4 to 5.4 gram per deciliter. Its principle is that it binds with specific dye in buffered medium to form green color compound, the intensity of which is proportional to the activity of albumin in the serum. And at last we have bilirubin, which is a byproduct of hemolysis and adopts conjugation in liver before its excretion. Normally present in 0.2 to 1.1 mg per deciliter. Principle is that bilirubin in the serum is reacted with diazotyl acid and form azobilirubin, which is detected at the wavelength of 520 nanometer. For procedures of estimating these parameters, we follow the following criteria. For liver enzyme, we use 4:1 formula with the quantity of 50 microliter serum. For albumin, reagent is used in 2.5 ml with 10 microliter 15 of serum. And for estimating the direct bilirubin, we have to use the reagent in 1000 microliter with 100 microliters of a taken specimen. Fasting of 10 to 12 hours is usually required for liver profile in order to get the accuracy in the results.